Welcome back. In previous modules, you learned about the definition of diabetes, how high blood sugar impacts your health, and the 5 Ds of effective diabetes management: diet, exercise, education, diabetes drugs, and self-monitoring. In this module, we will focus on blood glucose monitoring by learning a common procedure for home blood sugar testing using a glucose meter, and discovering an effective plan to test your blood sugar. Diabetes occurs when insulin, a hormone made by your pancreas, is unable to regulate the level of glucose in the body. As a result, glucose builds up in the bloodstream and causes high blood sugar or hyperglycemia. Your diabetes management focuses on lowering your blood sugar in order to attain and sustain recommended glucose levels. If you are taking medications for this, your glucose may go below the target range, a condition called low blood sugar or hypoglycemia. In short, hyperglycemia is high blood sugar and hypoglycemia is low blood sugar. So, how do you know when your blood sugar is high or low? Remember that the target glucose levels range from 80 to 130 milligram per deciliter. This will vary during the day, depending on your activity level and what you eat. Anything below 80 is considered low blood sugar, and anything above 130 is considered high blood sugar. Keeping healthy. Your diabetes management will center on keeping your blood sugar within the recommended target range. As we learned in Module 3, foods, particularly those high in sugar and carbohydrates, may raise your blood sugar, and activities like walking around the block after a meal may help lower it. Balancing your blood sugar is all about improving food choices and building healthy exercise habits. Medication helps supplement these behaviors to keep glucose levels in check. You have the power to reduce secondary complications of diabetes by learning about what foods have sugars and carbohydrates, finding physical activities that you enjoy, taking your prescribed diabetes medication consistently, and knowing your own blood sugar levels. One way you can help manage your diabetes is to test your blood sugar regularly. These tests will give you the information you need to accurately adjust your eating and exercise habits. Testing your blood sugar. Simple blood tests can be performed at home, letting you test your blood glucose level without requiring a trip to a clinic. To do this, you will need a home monitoring blood glucose kit that typically includes a meter, a lancet device, a supply of lancets, and blood glucose strips. There are several different brands of meters, but they all work similarly. Pick the one that works for you. Now let's begin. First, set up your meter with the current date and time and calibrate it with a glucose, sugar solution. Feel free to have your diabetes team help you the first time. You may want to stop this video to set up your meter now. Once your meter is calibrated, you're all set to test. Place a lancet in your lancet device and cock it. Click on the button a couple of times to launch the lancet so that you get the feel of how it works. Now, place a test strip into the meter to turn it on. Once the blood drop icon appears, the device is ready to test your blood. Choose any finger to do the test. You can use a different one each time. Gently squeeze on the finger you will test and press the lancet device. Not too hard, not too soft. Onto the side of your finger. It's less tender than the tip. Press the button to launch the lancet. You'll feel a slight pinch. It's not painful, but may feel a bit surprising at first. Pause for a moment and gently squeeze the finger you just pinched to help a bit of blood bubble up. Your meter won't need a large drop. Press the bubble of blood on the end or side of a blood glucose strip. It will suction up the blood until it's full, and your meter will begin to count down. It's really fast. Depending on your meter, you can have a blood sugar reading in about 5 seconds. Gently press your finger into an alcohol pad or tissue paper for 5 to 7 seconds to stop the bleeding. Avoid simply wiping it, as sometimes this won't seal the puncture. Recording your readings. Your blood sugar level will show on the screen. Record it into a daily log and clean your supplies after each test. Make sure to keep your log up to date and bring it to all of your diabetes doctor appointments so your team can determine the best medication and dosing schedule for you. Make testing a part of your daily routine and aim to test your blood sugars consistently throughout the day. This means, ideally, always at the same time of the day. Your meter will store your blood sugars for your doctor to download. This information helps them to decide the right type of medication, dosing, and timing. Viewing your logs can also help you understand patterns in your blood sugar levels at different points throughout the day. This information can help you strategize your diet and exercise goals to keep this level within the target range. A common plan to test your blood sugar. Your doctor will work with you to build a tailored schedule for testing your blood sugar. Here's an example of what this plan might look like. Before breakfast, or a fasting blood sugar. 2 hours after a meal, commonly after lunch. This helps you determine whether your blood sugar is returning to the target range. Blood sugars rise right after a meal, but should return to the target range after 2 hours. In type 2 diabetes, they may remain elevated longer. Before dinner after a busy day, when you're winding down. Before bedtime helps you assess whether you'll be going to sleep with high blood sugar, or if your medications are making your blood sugar go too low. You want to avoid sleeping with blood sugars that go above or below the target range. Let's recap what we have covered in this module. In type 2 diabetes, insulin doesn't work as expected, so blood sugar may be higher than the target range of 80 to 130 mg per deciliter. Through diabetes management, you have the power to lower your blood sugar by eating healthy and exercising as complements to your medication. Monitoring your blood sugar level is easy with the at-home fingerstick test. You must set up your meter according to its instructions, perform blood sugar testing at home, and make sure that you keep an updated log or diary. Ideally, you should test and log your blood sugar when fasting, before lunch, 2 hours after lunch, before dinner, and before bedtime. Make this a habit. It will provide information to adjust your routines and help your doctor to make decisions regarding medication and your treatment plan. Managing diabetes and reducing secondary complications is in your hands. Testing your blood sugar at home and modifying eating and exercise habits will help you keep your blood sugar within the target range. See you in the next module.